Chairwoman Miller-Meeks, Ranking Member Brownlee, and members of the subcommittee. I'm pleased to be here today to discuss our prior work on state veterans' homes. My testimony today describes the oversight structure of state veterans' homes and opportunities to improve VA's oversight. VA projects that the demand for long-term care will continue to increase, driven in part by growing numbers of aging veterans and veterans with service-connected disabilities. As of fiscal year 2023, there will be about 15,000 veterans living and being cared for in state veterans' homes at a cost of $1.5 billion. In our November 2022 report, we reported that there were 153 state veterans' homes providing nursing home care in the United States. These homes are an important resource for housing and care for some of our most vulnerable aging veterans. State veterans' homes are owned and operated by the states. However, VA provides per diem payments for eligible veterans to receive care in these homes. And as of fiscal year 2023, the average daily cost per veteran per day was $265. There are three entities that may have a role in overseeing state veterans' homes: the VA, the Centers for Medicare and Medicaid Services, or CMS, and the states. First, VA is the only federal agency that has oversight responsibilities for all state veterans' homes. And while VA does not exercise any supervision or control over the administration, personnel, or maintenance of the homes, VA does provide oversight through annual inspections. Through these inspections, homes are assessed against quality standards, cited deficiencies if they do not meet these standards, and then they are required to develop a corrective action plan to address the deficiencies. CMS also provides oversight of those state veterans' homes that receive Medicare or Medicaid. CMS certifies homes in order for them to receive funding. Once certified, CMS will conduct inspections about every 15 months to determine whether the home is meeting quality standards. We found that nearly 76% of the 153 homes in our study were also inspected by CMS. Some states also provide state-specific oversight of state veterans' homes. For example, these states may have state-specific regulations for nursing home quality, or they are able to take enforcement actions at the home. As part of our review, we found that 43 states conducted their own oversight in addition to oversight conducted by VA and CMS. Of the remaining 7 states where there was no state oversight, 5 states' state veterans' homes received oversight from CMS and VA, and 2 states' homes only received oversight from the VA. In our report, we made 4 recommendations for VA to improve its oversight of state veterans' homes, and 1 recommendation remains open. During our review, we found that VA's only enforcement action to compel homes to address deficiencies is to withhold per diem payments for veterans, a severe action that could ultimately impact the veterans' care. Officials expressed reluctance to use the enforcement tool unless under extreme circumstances. In fact, at the time of our review, VA officials could not recall ever withholding a state veterans' homes payment. Further, we found in our November 2022 review of 153 state veterans' homes, there were a total of 766 deficiencies. 40% of state veterans' homes were cited for the same deficiency in 2019 and 2021, and 21% of the deficiencies had corrective action plans that were past their due date. Moreover, in our review, we cite an example of a state administrator that noted they were more concerned with CMS's inspections because of the civil penalties. VA could benefit from having a range of enforcement actions, similar to CMS, that would provide a more effective tool to motivate state veterans' homes to comply with standards. CMS has a range of enforcement actions, including civil penalties, that are aligned with the scope and severity of the deficiency. Having a similar approach would help VA more effectively target penalties and better compel state veterans' homes to come into compliance with quality standards. During our review, VA told us that they were considering a legislative proposal to Congress for authority to impose fines or withhold a percentage of the per diem payment to address noncompliance with quality standards. We believe this to be a good step to creating a range of enforcement actions that would be effective. Subsequently, GAO recommended VA identify additional enforcement actions that would help ensure state veterans' homes' compliance with quality standards and seek legislative authority to implement those actions. Although VA concurred with our recommendation, they have not identified additional enforcement actions. Instead, VA has responded by developing a new enforcement plan that strengthens internal timelines and increases the follow-up with homes that have deficiencies. While these are good steps to strengthen oversight of state veterans' homes, they are not necessarily actions that will compel the homes to comply with quality standards. Our veterans residing and receiving care in state veterans' homes are our most vulnerable. Having a range of enforcement options that, for example, are scaled to the scope and severity of deficiencies, similar to CMS's range of enforcement actions, would provide VA with more effective enforcement and better ensure that state veterans' homes are providing the high-quality care veterans and their families deserve. That concludes my statement. I'm happy to take any questions.